All right, everyone, we are at 2 o'clock, so we are going to go on ahead and get started. My name is Dr. Tina Lewandowski, and I am the Director of Engagement here at the University of Kansas Alzheimer's Disease Research Center. I'd like to thank you for attending today, and we have a presentation from Dr. Kristi Williams. Dr. Williams is a nurse gerontologist at the E. Jean Hill Professor at the University of Kansas School of Nursing. Her NIH-funded program of research test interventions designed to improve communication between nursing home staff and residents with dementia and support family members caring for persons living with dementia through communication and use of technology. She leads caregiver research at the KU ADRC and is the co-director of the Integrating Special Populations Hub for Frontiers CTSA and KUMC. All just a friendly reminder to please keep your microphones on mute. And if you have any questions during the presentation, you may type them in the chat. We'll leave plenty of time at the end of the presentation for Dr. Williams to answer your questions. As always, we will have the recording available on our website within 24 hours. Thank you so much, Dr. Williams, and we will turn it over to you.
All right, thank you. Thank you for inviting me to talk today. I'm going to present today about a research study that my team is in the process of conducting that's working to determine what works best for overcoming barriers to communication that occur while using personal protective equipment, namely masks. And the research focuses on staff who work in nursing homes, but much of this information is really applicable outside of nursing home settings with the general public, people who care for older adults, or even for all of us who are faced with wearing masks as personal protective equipment. So hopefully there'll be some nuggets that you can take from this presentation. I first wanted to just acknowledge my research team, the funding by the National Institutes of Health for this study, and tell you that we have no conflicts of interest. So as I said, this is part of a larger research study, and our research focuses on person-centered communication and improving communication in nursing home settings. And we currently have a clinical trial, a big grant going on that focuses on reducing elder speak, which is communication that sounds like baby talk, that's frequently used in nursing homes by nursing home staff. And what we've found is that when staff use this kind of communication with residents are likely to respond negatively with challenging behaviors. So that study was funded right before the pandemic started. But as we were working with the nursing homes, we realized what a big barrier having to wear masks and other personal protective equipment was for staff as far as communication. So we got some additional funding from the NIH to explore how to best communicate with a mask on, and then to develop a short training module for people working in nursing homes to help them communicate as best as possible while using their personal protective equipment. So we did two things to determine what the best practices are, because this was relatively new. We first looked at the research literature, but there wasn't a lot out there as far as research articles. There were a lot of kind of opinion articles or experts, but they weren't really tested in a rigorous research kind of study. So we proceeded to go to the people who were experiencing the problems or the challenges of communication in the nursing home while wearing personal protective equipment. And we did focus groups and a few interviews that included 10 staff in nursing homes, which ranged from nursing assistants, social workers, activities people, dietary nurses. We also talked with 5 nursing home residents and 4 family members of residents that had dementia in nursing homes that were in 4 states, Kansas, Washington, South Dakota, and Virginia. So we recorded all of the focus groups and interviews, and then we had them transcribed or typed up so that we could do a qualitative analysis. Basically, we read through everything and kind of grouped things together and decided that we had 3 main findings or themes from the study. And they're listed here. First of all, that the pandemic presented significant and unique communication challenges for everyone involved, residents, families, and staff, that successful communication to overcome barriers of a mask is possible really by going back to our general communication strategies and using person-centered communication that includes building on a relationship that you have with the person you're communicating with. And then the last theme was that through all of this, people developed ways to cope and manage the stress and the requirements of wearing PPEs and adapted so that this has become more or less a normal part of care. So I'm going to go into each of the themes a little bit to kind of give you a little more depth of information. So the challenge that was presented to everyone had 4 different sub-themes. The first was that the lockdown aspect of the pandemic was the hardest aspect for everyone. And this was that residents, family, and staff all echoed that the lockdown and isolation. So when people couldn't come into the nursing home, families couldn't come in. And when some residents had to stay in their room and couldn't even go to the dining area for meals and be able to socialize, that was the greatest challenge that everyone brought up. And the challenges related to wearing the masks and other protective equipment could be overcome, but that the isolation from the lockdown was really pretty devastating to everyone. The second theme was that it was important, especially for staff, to understand and acknowledge the resident and family perspective. It was particularly difficult to balance autonomy. So, because if you think of it as the resident's home in the nursing home, they should be able to decide what they do, whether they wear a mask, whether they have visitors and that. But you had to balance that with the safety for other residents and staff. And so that was kind of a dilemma for the staff because they wanted to honor the residents' autonomy, but it wasn't always possible because of infection control requirements. And then we also had challenges for staff, and that centered around constantly changing guidelines for what they needed to wear as far as the different types of masks and personal protective equipment, discomfort from wearing masks, and limited resources. If you remember at the beginning of the pandemic, there were not enough masks for everyone. And then finally, that the communication challenges were significant, then really affected everyone. So I've got some quotes just to kind of illustrate how we came to these themes as far as the challenges. So the first one's from a family member. So she's talking about her family member that was admitted to the nursing home. So I'll kind of read these quickly. Well, she came to the nursing home in April, so it was bright as everything was started. She was suffering from the effects of an infection, so she already had some confusion, and this did nothing to help that. She was tearful for weeks, and she didn't understand why we could not come in, and why she was here, and why we could only talk through a window. It was awful for her. A staff person remarked, I was working with a lady that has light dementia, and I put my mask on And then I went up to try to help her, and she thought that I was somebody who was trying to break into her house. But now it's been over a year and a half that we've been wearing masks, and I think that the residents have gotten used to it. But initially it was challenging, and not just with dementia patients either, but people that are hard of hearing and people that are visually impaired too. It's not just dementia patients, but everyone that has obstacles. The second theme that we came up with was that the use of general practical communication strategies and person-centered communication strategies were the most valuable for overcoming barriers to communication while wearing a mask. We've got a lot of them listed here, and I'll talk about some of them in the next couple slides. But I wanted to just kind of define what we mean when we talk about person-centered communication. Person-centered communication focuses on an individualized communication based on knowing the residents on a meaningful level. And the staff in our study voiced that communication with residents was easiest with residents that they cared for long before the pandemic began, and hardest with new residents they did not have an established relationship with. However, even the residents they knew did not always recognize them in their personal protective equipment. So this sometimes caused fear, particularly during the night, and with residents with dementia as well. So these are some of the strategies that were suggested and that we've included from the focus groups in our training for staff that hopefully might be helpful for all of you as well. First of all, with the mask on, your verbal communication is reduced in volume and clarity. That particularly people with hearing loss that rely on reading lips have lost that ability to do that. So it provides an additional challenge. It's important to speak loudly and clearly. And research actually supports this approach that's called clear speech. The best way to know if a resident can understand you is just by asking. This can be as simple as saying, "Can you understand me?" Or something like also telling them, "I'm talking loudly so you can hear me. Can you hear me okay?" So these were some of the verbal strategies. As far as the nonverbal communication, we know that nonverbal communication frequently provides a stronger message than the words themselves. This means that it's important to pay careful attention to posture, appearance, expressions, eye contact, gestures, and personal space. In our interviews, residents and staff discuss the importance of using positive body language and voice tone to not appear rushed or angry. And unfortunately, because face masks cover facial expressions, which are a big part of nonverbal communication, residents cannot read nonverbal cues under the face masks. So oftentimes one needs to use words to communicate emotions instead. And the last practical tip was in reducing environmental stimuli and noise. Residents will be able to understand better if they can focus on speech and not the other distractions in the environment. And beyond creating a quiet environment, if possible, staff recommended creating a pleasant environment based on the preferences of residents. And again, this goes to knowing what the resident prefers and likes. And I've got a couple quotes here from our focus groups as well. This is on the strategies. I think these are both staff. You know that being muffled, you have to talk slow, you have to talk loud using your eyes to show emotion. And also your tone of voice, you know, raising it or lowering it so the person knows if you're excited or happy or whatever it is. it's more difficult with the ones that already have hearing issues. So sometimes it's just about speaking slower and louder. And then sometimes it's just about hand gestures and body language. And a second staff person said, I always check in and make sure the person can hear me and understand me before I get into the conversation. Asking, did you put your hearing aids in today? Can you hear me okay? Raising your voice, obviously, like an outdoor voice, you sometimes have to. And with a couple of residents in this staff nursing home, they've used whiteboards so they can write things out for them to read if they're very hard of hearing. The third theme was adaptation or normalization. So wearing masks eventually became normalized as a beneficial or simply a required part of care. Sometimes residents were very adaptable and flexible, but sometimes others were not. And as the pandemic continued, normalization or adaptation to using masks occurred, but there was also some dejection or feeling that there was no end in sight. With complaints about physical discomfort and challenges to communication as being the leading problems. And staff tried to put a positive spin on having to wear PPE, validating the difficulty of the situation and use stress and coping strategies to help residents. And I've got two quotes from the staff related to this theme. The first one is, at first we were doing a lot of explaining because the residents would just look at us and throw up their arms to indicate like, what is going on? Why are you guys looking like you're in the ET movie with gowns and everything? When the pandemic first started, everybody was terrified and in a big panic. Then the guidelines changed. And at this point, all the residents are just totally used to it. It's just everybody is wearing their mask and most of them comply. And the staff all complies, of course. We do not have a choice because it's expected. And the other staff said, it is kind of like I do not really see masks going away anytime soon. I honestly see it going into many years from now, and that's fine. I'm totally used to it at this point. So it's just is what it is. We also found some reports in the literature about how different types of face masks affected communication. And the research says that certain face masks carry your voice better than others. And these tend to be medical or what we call surgical masks. There's one in the picture on the slide there. And also for the KN95s and N95s. As far as those go, the N95s performed worse than those surgical masks. So it's important to remember if you're using one of those to speak especially clear. And poor fitting fabric masks performed the worst as far as it was the most difficult to communicate through the fabric masks. Some people have developed and tried clear masks, so you can at least see part of the lips and the facial expression, but there's kind of evidence suggesting those help and some that suggest they don't help. So we don't have a real strong conclusion either way on clear masks. And the other thing is that you may be required to use a certain kind of mask if you're like working in a healthcare setting, because different masks have different protective value. This is a screenshot from this module that we've developed as the second part of our research study to improve communication with PPE. And basically what we did was we developed this communication checklist that listed a lot of these different strategies that were effective in promoting communication with a PPE. And we used that, and then we recorded a scenario, a care scenario. You can see a picture, one of the frames from that, And at the beginning of the program, the people in the video don't use the good communication strategies. And so the people taking the training see what that's like and how the person responds. And then by the end of the training, we're using all the things in the communication checklist the people in the video are, and it results in a much more effective communication. We are currently working on finalizing these modules, and at the beginning of the year, we're going to be testing them with nursing home staff, 40 different nursing staff around the country, and we'll be looking at whether they gain knowledge in identifying the effective strategies and whether they're more confident with communication. And then we'll be following that up with some more focus groups to see if we need to modify the training at all. So our implications are that the pandemic and need to use personal protective equipment added communication challenges for everyone that really affected older adults and long-term care residents, family, and staff, and certainly affected the rest of us as well. And that strategies will likely be ongoing, especially now that we're having the triple-demic with respiratory syncytial virus, RSV, and flu as well. And that basically the strategies include building on our the communication effectiveness strategies and person-centered communication that we already knew were important. They just seem to be more important when wearing a mask. So that's my presentation, and hopefully we have some questions.
Thank you so much, Dr. Williams. Does anyone have any questions for Dr. Williams? I'll ask just one more time here. Does anyone have any questions for Dr. Williams while we have her here? Okay, well, not seeing any questions. Dr. Williams, thank you so much for engaging us today and chatting about something that's relevant that we have all experienced. Oh, it looks like Ed has a question here. Where can surgical masks be purchased? So, Dr. Williams, what are some outlets that you would recommend to purchase surgical masks?
Well, I think that you can purchase them in most pharmacies, or I would think places like Walmart and that probably have them in their pharmacy medical supply area. I know that you can purchase them on Amazon if you're not getting out to the store. And I think that frequently I notice, like if I go to a healthcare facility or even the doctor's office, they have like a little stand of them at the door. So you can, so that they've tried to make them readily available when anyone comes into the different settings. And then there have been the programs where you can order them online. I don't know that there's any more of those going on, but
yeah, all great ideas there, Kristi. And I know I've purchased mine through Amazon as well. That's what I've got mine. I picked them up, and it's almost overwhelming with the amount of choices that you have. So, Kristi, thanks for talking about the masks and the projection and kind of looking at what you need them for your setting. So that's helpful to kind of narrow down the wide array of mask options that are out there now for all of us. All right, any other questions for Dr. Williams? All right, well, Dr. Williams, thank you again so much for this presentation and for joining all of us. And everyone, I wanted to let you know next week will be our final weekly webinar presentation for 2022. And that'll be next Thursday at 2 o'clock. More information about the presentation can be found on our website, and be sure to look out for that information in your My Alliance Monday email, or visit us at kualzheimers.org. This presentation will be available on our YouTube channel shortly, which you can find by navigating on our website under weekly webinar, or by using the link in the reminder email. If you have any questions or comments in the meantime, feel free to email us at myalliance@kumc.edu. Thank you, everyone, and have a wonderful rest of your week. Thank you.
Thank you.